Hey everyone, our first topic we hope to educate you a little on is multiple sclerosis or MS, which is nerve damage that disrupts communication between the brain and the body. MS is said to cause many different symptoms, including vision loss, pain, fatigue, and impaired coordination, and often affects women in their prime between 25 to 44 years old. And recently, Montefiore's MS Center earned recognition for the National MS Society with the designation of Center for Comprehensive MS Care, making it one of two centers to earn the honor in the Bronx. And here to share more is neurologist at the Montefiore Multiple Sclerosis Center, Dr. Lauren Gluck. Hello and welcome.
Hello, thank you for having me.
Well, thank you for being here with us. And thank you for what you do and how you serve our community. I gave everyone a little introduction regarding multiple sclerosis, but could you elaborate further and maybe help us understand, is MS hereditary?
Those are two good questions. So first, what is MS? You gave a great summary. So MS is a brain disease. So it's of the central nervous system, and it does disrupt communication between the brain and the body. It can cause all sorts of symptoms that can also include weakness and numbness and vertigo. And these things can be tricky to identify because they may come on very gradually over the course of a day or a few days. And sometimes they get better on their own. So people just say, it got better. I'm not going to tell my doctor about it. But it is important to tell your doctor about it and have a good, open, honest relationship with him or her. So who gets MS? So this is more common in women than men, more in their 20s to 40s, but it can affect people younger, including children and teenagers, and people older in their 50s or 60s, maybe older. And it's not exactly hereditary, although there is a genetic basis for it, meaning it's not like there's a gene for brown eyes. So most of your children will have brown eyes. This is much more complex, where there are over 200 pieces of genes that you have to have that only just put you at risk. And then something happens as you get older in your teens or 20s or more that kind of trigger those genes to work. And so things that we identify as risk for that is smoking cigarettes, is childhood and adolescent obesity. And more recently, we've gotten better data saying that maybe the infection that causes mononucleosis or the kissing disease called Epstein-Barr may be related. But that's also something that almost everyone gets or gets exposed to. So we're not sure how to deal with that just yet.
So in the research that I was doing, and I find this very fascinating, I started diving in a little deeper, and there was this one article that talked about clusters in being in a certain environment and possibly is it contagious? Like I want to understand, like it's not hereditary, right? So it's not it's something that you should concern yourself with if somebody in your family has it, but if you're in the immediate environment, you should concern yourself with. Can you help me understand that?
Sure. So the first part of that, is it contagious? No, this is not an infection, right? We've spent so long talking about COVID. This is not like that at all. And maybe I'll correct myself a little. So this isn't hereditary the way we think of things that are passed down definitely generation to generation, but there is a risk of having it in families. So if you are a parent with multiple sclerosis, your child will have a higher risk than another child, but it's not a high risk. So the truth is, MS is actually very common. There's almost 1 million people in the US who deal with MS. So if the risk overall it's less than 1%, but the risk if you have a child or first degree relative goes up to about 2 or 3%. But that doesn't mean you can't have kids. We actually encourage women or people who are able to have kids to talk to us so we can make a good plan for pregnancy and afterwards. But it does mean that if your child ever comes to you and says, hey, I'm noticing this problem, my vision is blurry, my arm is weak, you take them to the doctor like a good parent should. You don't have to take them to a neurologist in general for just a checkup. You don't have to get them an MRI, which is often how we diagnose MS. One thing that some people can take if they have a family history or they're worried, is vitamin D. There's some evidence that that helps reduce brain inflammation in MS, and the truth is we're all low in vitamin D, and it affects our mood and our energy and our bones. So it's a good addition to our vitamins.
When you say we, you're us New Yorkers, because
Us New Yorkers, we do not get enough sunlight that helps us get higher levels of vitamin D.
and so why is it more common in women?
So MS is also an autoimmune disease where the immune system that fights infections sometimes messes up and starts attacking our own bodies. And these often run more in women. So we think maybe it's part of that, nuanced genetic issue. It may be related to some hormones, but we're not entirely sure why. That being said, it still affects a lot of men. So if you're a man who has some of these symptoms, still go to your doctor. It's still worth a conversation.
And so what are some of the statistics within the Black and brown communities?
So that's something that we've been talking about more and more in the MS community, because in the past, there's been this notion that MS occurs more in Caucasians, but now we're recognizing that that's not true. Actually, higher rates of diagnosis are occurring in Black and brown communities. We're not sure if there is a genetic part to this. It may be that Black and brown people weren't really involved in the studies that we used to do for multiple sclerosis, and now are being much more proactive about reaching out to people in their communities, in their languages, to show that they're represented appropriately.
So for right now, it's safe to say that you're suggesting that everybody make sure that their vitamin D levels are normalized or at a higher rate than what.
Yes, whether or not you have MS.
Right. That's doctor's orders. And
doctor's orders.
That's right, Dr. Gluck, to be exact. And so before we go, can you share with us a little more about the Center for Comprehensive MS Care and the services organized by the National MS Society?
Absolutely. So our MS Center has been around since 2019. We work with physical therapists, occupational therapists, speech therapists, neuropsychologists, urologists for bladder concerns, therapists, and many other partners in care that people with MS may need. The biggest thing that I do as the MS neurologist is help people get into treatment plans with medication. So a big take home for MS care now versus even just 30 years ago is we have so many medicines that can control the disease and limit disability related to it. So people can feel like themselves, can work, can play with their kids. And so that's why it's also important to connect to a doctor that you trust if you're noticing some odd symptoms, so you can get on a treatment plan and have more success for the future.
Wonderful. Thank you, everyone. Thank you, Dr. Lauren Gluck, neurologist at the Montefiore Multiple Sclerosis Center. You guys, for more information, if you see or feel that you're coming with down with any symptoms, you can always visit their website and just research further by going to montefiore.org. We have to take a quick break, but when we return, we'll hear about these spooky, ookie, kooky events happening at the Village Halloween Parade 2022. Don't go anywhere.